Okay, so just for clarification, I frame this really around the highlights from the ART track session rather than reflections. So on Monday, our large group discussion was framed around the question of the ways in which the commercialization of ARTs both undermine women's self-determination and well-being at the same time as they expand options and access for family formation. And we considered if there were justified legal, ethical, or economic limitations that ought to be imposed on the commercialization of ART. Susan Fogel began by introducing an initiative spearheaded by the Center for Genetics and Society and the Pro-Choice Alliance for Responsible Research to start an ART working group. By invitation only, the group will, through listserv and conference calls, begin to provide space for continued discussion and strategizing on ART developments. So we were thankful to have at the very outset an organizational prospect for continued work on these issues. On the question of access, Lisa Ikemoto summarized a sentiment voiced by several participants that any call for regulation would have to be accompanied by anti-discrimination laws in order to protect the access to ARTs that markets have enabled to LGBT couples, single women, and people with disabilities. We felt it was important to document continued lack of access based on income disparity. Adam Smith from the UK reminded us that commercialization pressures can change thresholds for access and have led to new laws in the UK to raise those thresholds. Sally Whelan argued that while access is important, when access for some breaches the human rights of others, then a line is crossed. Diane Tober discussed how everything is transacted in ART markets, from the identities of donors to the wombs of surrogates, and different valuation occurs depending on whether the coveted genetic material resides in the eggs or the embryos in working wombs. Francine Coiteau encouraged us to consider whether models of non-payment such as exist elsewhere in organ donation could be employed viably as a means to avoid potential exploitation associated with commercial transactions. But Alma Betran Puga and Regina Thames, I'm sorry if I got your names wrong, our colleagues from Mexico, voiced a sentiment that I think met with a lot of agreement, and that is that markets are here already and we need to protect women's autonomy inside those markets, and that non-commercialization, although attractive, is no longer a practical solution for many of our concerns. On the question of regulations, Vaishali Sinha and Daisy Diomampo pointed out the unintended consequences of pushes for regulation driving markets underground or abroad, and they questioned the effectiveness of enforcing bans. I pointed out the fundamental conflict of interest of charging those with vested commercial interests in ART with the task of ensuring its ethical practice. Several participants suggested that a good place to begin would be in a call for regulation of egg brokers and their marketing. Lisa Ikemoto and Molly Shanley reminded us that choice and agency are defined differently today than in the past, where notions of choice and equality were once inherently linked. Today they are delinked, and choice means volitional action in a commercial market. Katayun Chamani and Judy Norsijian raised the problem of long-term downstream effects on the children produced by ARTs, the lack of registries of the children, and the lack of voices of the offspring in these deliberations. Daisy, Vaishali, Molly, and Marcy discussed the importance of determining the status of stateless children born via cross-border uses of ART, perhaps through international treaties and other mechanisms that define or redefine parenthood. In addition to calls for data collection, registries, and licensing, there were calls to improve equitable access through insurance coverage of ARTs, calls to improve informed consent with language that we don't know related health effects, and in a way that would counter monetary incentives. For more calls for more equity in research through community-based research methods, for different language to humanize terms such as gestational carrier, and for telling stories of those who opt out of physician-recommended protocols, and for normalizing disability and inclusivity of the voices of people with disabilities in all of these discussions and actions. We spent 2 days, or days 2 and 3, honing in on a few strategies, including the idea of developing a public education campaign directed at policymakers, fertility clinics, and their websites, and the public at large that would underscore the need for long and short-term data on egg providers and long-term follow-up on the psychosocial and medical effects of gamete provision for providers, recipients, and their offspring. We discussed the prospect for disability and reproductive rights groups to work together to develop a joint response to non-invasive prenatal diagnosis, and legislative proposals to ban sex and race-selective abortion. More generally, we devoted quite a bit of time today to thinking about a rating system that could evaluate clinics on their use of best practices with participation from consumers, providers, and their professional associations. The Pro-Choice Alliance for Responsible Research and the Center for Genetics and Society agreed to, or members of those organizations agreed to take the first steps on drafting a list of such standards and to seek an APHA, or American Public Health Association, resolution in support of them. So, did I make it 6 minutes? Okay. All right, thank you.